to connect the chat. Let's do that again. There we go. All right, so make sure you chat in your questions if you have them. We're live. A lot of people sent in questions, and like I always remind everybody, you can go to holistichealthhour.com, holistichealthhour.com, where you can send in your questions like everybody else has done. But certainly chat in your questions, and we'll try to get to them. So let's jump in with some questions. Doing this from home today, a little hot and tired. Just came in from doing some gardening. That is our passion, is to garden. So but let's get to your questions. Okay, how to stop proteinuria. So proteinuria is when you have protein in your urine, and it tends to be a chronic issue. I wouldn't even say it's a condition because it's typically benign. It's not usually an issue whatsoever that you need to worry about. If that was my only clinical finding, didn't have any symptoms, didn't have any other blood work, changes. And remember, when you look at blood work, so this would be a urine sample that they would find that. But if you look at blood work, there are different parameters that you want to look at. So I have a video on this that details this on our website. So you can find a lot of information on our website, connorsclinic.com. If you go to the blog, well over 1,000 blog posts. Most of them have videos tied to them, be explaining different things. But when you look at blood work, there's a difference between lab ranges and functional ranges. So you might be normal. Your doctor may have said, everything's normal. I tested your blood. Everything looks normal. Everything's good to go. But you're outside of a functional range. So the only way to know what that is, I suppose you could Google functional ranges, but to find a functional medical doctor or practitioner like ourselves that can look at your blood from a different perspective. So if all my blood work was within normal ranges, I had no symptoms, no other signs of issues, no other objective findings, and my only objective finding was high levels of protein in my urine, I wouldn't even consider it. There's probably some genetic factor that goes along with it. But I would look at the big picture. So you don't just look at one test. So if that was the only thing I had going on, I wouldn't be concerned about it. Next question. Hi, I'm immunosuppressed from Lyme combined with an autoimmune gene, even though my Lyme is in remission. I spent my life playing whack-a-mole with herbs, essential oils, professional homeopathics, whole and organic diet, now more restrictive. That's caused me to lose muscle mass for a specific super biofilm manufacturing pathogen, home procedures for parasite reduction, now 3 times a week for flourishing protozoa, detoxing, etc. So that's a common initial subjective findings of somebody who's been diagnosed with chronic mold or chronic Lyme disease. They've just been all over. They're doing a lot of different things. They played whack-a-mole. I like that terminology the person's used, with herbs and supplements and all this kind of stuff. So their question is, it's been years, and my financial resources are depleted, and CRISPR, so if you don't know what CRISPR is, that's genetic engineering of a person's genes, doesn't seem to be an option at this time. So there's a lot of research going on with CRISPR. A lot of people think it's extremely dangerous. Some people think it could be, miracle medicine of the future, but that's for another time. It's been degrading over time, so I haven't felt well in years, as it's truly a game of whack-a-mole to stay alive. Do you have any advice regarding repairing my immune system and stopping the dendritic cell damage, or where to turn? So dendritic cells are immature white blood cells that will change into whatever is needed at the time if there is a local infection. So I would recommend getting on our autoimmune course, honestly. I certainly can't say, oh, just take this and this is going to be a miracle cure. If I said that, you should probably not listen to me, because there is no such thing. And, people sometimes get mad when they're on calls like this and they want us to, you're just like this one magic supplement away from curing all your problems. Sometimes people are looking for that. I don't think this person is looking for that. But the truth is, you got to learn how to handle, if you truly do have an autoimmune disease, which is extremely common with people that have had chronic Lyme or chronic mold or chronic health conditions, for more than a couple of years, you have to investigate, do I have an autoimmune disease? And then you treat, everything's out the window. You have to treat everything differently. So if you're using herbs, you're using essential oils, and even sometimes homeopathics can stimulate an immune response. And if you stimulate an immune response and you have antibodies against self-tissue, you have an autoimmune disease, you're going to kill that which you have antibodies against, meaning you're going to kill your body. So you're going to have like a Herx type reaction, but it's not really a Herxheimer reaction. It is self-destruction. So it's damage to the tissue that you have antibodies against. So investigating that would be my concern. So if you called our office and you did a case review with me, I'd say we need to do some autoimmune testing. Even if you had some in the past, autoimmune diseases have 3 phases to them. So it could be in a very, very early stage, not even to the latent phase, where it doesn't even show antibodies to self-tissue anymore. So I've had people come in and say, well, I did antibody testing 3 years ago, my condition's gotten worse. Then we run antibody tests and they show ANA antibodies or thyroid antibodies or rheumatoid antibodies or neurological antibodies. And these are very, very serious conditions, and you have to treat them, completely different. Once you have antibodies to self-tissue, your whole treatment procedure has to change completely. So you cannot be using any immune stimulants in herbs, vitamins, etc. So you have to be very careful on what to do. I'd suggest get on the course. You can go to ConnorsClinic.com, and from ConnorsClinic.com on the top, you'll see courses. The chronic disease autoimmune course is what I would suggest. And I'm not just trying to sell stuff. It's $50 to take the course, and it's got dozens and dozens and dozens of videos and education in it. So we have doctors that are taking the courses. They're very beneficial. Okay, what is the benefit of grounding? Should I use a grounding sheet? Well, that's an interesting question, because I have a grounding sheet right here. So first of all, most people know what grounding is. I remember talking about grounding 10 years ago or so, and everybody's like, what? What are you talking about grounding? Most people have heard what grounding is. So grounding is basically helping discharge positive ions off your body. That's basically what grounding is. We live in a world where there's, how can I turn on a radio with a little antenna and I can get all these different stations? Because there's radio waves going through us right now. Does that damage our body? I don't know. Does it add a charge to our body? Yeah, I think so. I'm sitting in front of a computer screen. If you're watching me, you're sitting in front of a computer screen or your telephone. Those are EMFs. Those are charge. These are electrical frequencies. They're electrical charge. And these electrical charge stay on our body and in our cells, on our surface of our tissue, our skin, and they need to discharge. So grounding is walking outside in your feet and touching the ground, and you're discharging those positively charged protons. The earth is balanced in its electrical charge, and it can definitely give away some electrons to balance you out. And that's what grounding is. That's the benefit of, having animals that are walking around with 4 feet on the ground, and you go and pet the animal. You're basically discharging your positively charged EMFs to that person, to that dog, to that horse, to that cat, whatever it is. That's the benefit of pets. So especially in cold areas and cold climates, how do you ground? I'm not going to walk around outside in January in my bare feet. Well, some people do, but I don't think I will. Well, you could use grounding instruments. Your house is grounded, hopefully, unless you live in an old house and your electrical outlets aren't grounded. Matter of fact, I think in here we have a little testing device. So in our grounding sheet that we sell, we have the little testing devices to make sure your outlets are grounded. because if you plug this ground sheet into an outlet that's not grounded, it's not going to work. It's not going to do anything. So the idea is in grounding, using a grounding sheet or a grounding mat or something like that, you are plugging it into a grounded outlet. The ground, the third prong of a grounded outlet, that goes back via a copper wire back to your electrical box, and then it connects to a main ground bar that's connected to a heavier cable, copper cable that goes outside and connects to the ground. So you're basically grounding like walking outside, but using your grounding of your electrical in your house. Now, if your house is older, you don't have any three-prong outlets, or you use a device like this and none of your three-prong outlets are actually connected correctly or not grounded, you may need to call an electrician first and make sure that is done. But you can easily check it with this. If you don't buy a grounding sheet from us, you can buy one of these at your local hardware store for less than $10 or get them on Amazon. It just checks if your outlets are grounded. And then a grounding sheet is a material that has little wires in it, basically. That then this snaps on to a cable that connects to that third prong of a grounded outlet, and that's how you get grounded. So the benefit of using a grounding sheet is you're basically grounding yourself all night. It's hugely beneficial. So our grounding sheets that we have made specifically for us are half sheets. So they only go on the lower half of the bed. Well, why is that? Because there's a whole bunch of grounding sheets out these days that are full sheets that cover your full mattress, and isn't that better? Well, yes and no. So when we have patients that are using a Rife machine, using Rife technology, or trying to get good frequencies in them, we don't want those good frequencies to just disperse through the grounding sheet back to the ground outside through your wiring. So I only tell people to only put it on the bottom half of their bed. It's like you don't need to, when you go outside to ground, you just stand in your bare feet. You're discharging those positive charged protons. You don't need to go hug the ground. So you just need a part of you touching that grounding sheet that's going to help disperse those negative charges. So grounding is great. People, I tell you, there's thousands of testimonials of people that have had arthritis issues to migraine issues to whatever you name it. It can have to do with the frequencies that you're picking up, all these negative EMFs that you're picking up. I mean, people think of EMFs as, oh, they can cause cancer, they can cause brain cancer, they cause all sorts of ill health. So grounding yourself is really beneficial. Maybe it's one of the reasons why I love to garden. A lot of people love to garden. They just like to get their hands dirty. Well, you're grounding yourself. That's why you feel calmer when you garden. Usually, maybe not this time of the year. I feel angrier sometimes. You got too much to do, but that's another story. Okay, next question. Hi, any suggested help for chronic diarrhea, meaning often starting several times daily and lasting for several sequential days and sometimes weeks, at times a few days break, and then start out again for a lengthy time period? And while the diarrhea is occurring, what are possibly the nutritional deficiencies that it may cause? Thank you. So you could say, oh, what's help with chronic diarrhea? Well, first, again, with anything, you have a symptom, you have a sign, an objective finding, this symptom that you're experiencing. You got to find out why. So why do you have this? What is the reason? I would do a stool test. So I would do a comprehensive stool analysis. That would be a first step. You have to find out if you have parasites. You have to find out if you have H. pylori, which is a bacterial infection, very, very common. Your microbiota might be totally messed up just from the diarrhea itself. It's going to mess it up. What other deficiencies could you have with this? Well, anything, because if you're not keeping food in you long enough to absorb your nutrients, you could be deficient in all sorts of nutrients. Certainly, you could be deficient in just fluid in water. So you could have dehydration type symptoms too. You got to get to the bottom of this. This is not normal. This is not healthy. It's not good. Getting a comprehensive food stool sample test is what I would start with. I don't know who asked this question, but if you want to work with us, you need to schedule a case review, and then you can order that. We can order that test. You got to get to the reason why. With anything you got going on, you want to find out why. You don't want to just, we'll just start taking this, or we'll just start doing this, or we'll just start doing this, because then you could actually mask the problem. That's not good. So that's the problem I have with so many medications. So we're just going to start taking Imodium because I have chronic diarrhea. We have chronic diarrhea for a reason. So your body's trying to expel something. What is the abnormality going on? Could be something as simple as a stuck ileocecal valve, to something as bad as a complete imbalance in gut microbiota, parasitic function, H. pylori, other bacterial involvement. You got to get to the root of this and fix this. Could be something as serious as cancer or something too. So it's not something just to. That's why I think it's a mistake just to mask symptoms. Whether you use herbs to mask symptoms, vitamins to mask symptoms, or using a medication. What difference are you doing? You're still masking the symptoms. I'm doing it in a natural way. Okay, it's just as bad. So it's just as wrong to use natural medicine the wrong way as it is to use medicine the wrong way. Why do you recommend that cancer patients should eat meat? I thought we should all be vegan. Well, no, I don't think we should all be vegan. Matter of fact, I don't think very many people at all should be vegan. I think meat was for us to eat. Now, I'm not saying that, I think everybody's different and everybody's unique. There's some people that do much better on a more vegan diet. And there's most of the people that are eating vegan for philosophical reasons, not necessarily health reasons. Now, I know there's a lot of books out there, Forks Over Knives and Food Revolution type books. I don't know if that book itself is talking about veganism. But it's unfortunate that when you find out that these books were sponsored by PETA organizations or something like that, the author was paid by an organization that promotes veganism. That's political agenda masking as science and masking as good exegesis of how our physiology works, because that's just not true. There's a lot of people out there on the internet. I see Instagram videos of people saying we were not created to eat meat, we were created to eat vegetables. That's just total nonsense. We were created to eat meat. Maybe some people eat too much meat. Maybe some people don't eat enough meat. But certainly with cancer, the reason why I promote meat consumption with the majority of people, to understand we test people as an individual, and some people we take off meat. But why I don't think everybody should be vegan, why I feel very few people should be vegan, especially in the cancer realm, is that you need enough protein in order to make a certain type of white blood cell that will kill cancer. So it is the T cells and natural killer cells that kill cancer cells, and you need a lot of free amino acids. The only way you're going to get that free amino acid content is to eat enough protein. And most of the time, cancer patients are already insufficient in their diet as far as how much they can eat. They don't feel well. They might have other comorbidities. They may have comorbidities from their treatment via, let's say, if they're doing chemotherapy or immunotherapy, they're not feeling well. They don't, eat what they should be eating, and they're very often deficient in protein. Matter of fact, that's one ominous sign that a person can have cancer is low blood protein levels. So when you have a total protein or albumin levels and globulin levels that are deficient, that is an ominous sign for possible cancer in itself. So you need to consume enough protein, and you could say, well, we can do that through our vegetables, we can do that through beans, we can do that through this. Well, maybe a healthy person can eat enough of that, but you really need to consume your weight, your desired weight. So if you've already lost weight from cancer and you're below your desired weight, let's say your desired weight is 150 and you're at 135, you need to eat 150 grams of protein per day. That's a lot of grams of protein per day. Now you could get that in if you eat several pieces of chicken with your other diet, but it's hard to get that in with a protein shake or anything like that. It's just very difficult to get that in. You need adequate amounts of protein to do that. Plus, protein, especially in red meat, can help with red blood cell formation, which anemia is another major issue with cancer patients. So please be aware that a lot of books that are on the market are not well balanced. They have an agenda behind them. They're pushing a certain agenda. They're pushing a certain philosophy, which is really a religion, and it's not the religion that I adhere to. So I don't think those things have as much value as some other people put on them. Question: what do you think of drugs like Prilosec or even taking Tums? So I think they're one of the most dangerous line of drugs. There's a lot of dangers, so I shouldn't say that. They're a very dangerous line of drugs, because why does a person go on Prilosec? Why does a person take Rolaids or Tums? Because they have indigestion, because they have belching of stomach acid up the esophagus. They have stomach pain after eating. They have all this stomach pain, and 99% of the time that is from a deficiency in hydrochloric acid. So these drugs will remove all the hydrochloric acid or diminish the hydrochloric acid production in your stomach, which is exactly the thing you don't want to do. Well, how can you say that? It takes my pain away. So it must be solving the problem. So when a person doesn't produce enough hydrochloric acid in their stomach and they eat food, that food will sit undigested or very partially digested in the stomach as a bolus of food, and it doesn't get moved into the small intestine at the rate that it should, because it's only very partially digested because of the hypochlorhydria, the decreased hydrochloric acid. And then what stomach acid you do have can go up into the high point, the fundus of the stomach, and you can belch it up. Most of the time, these people also have a concurrent hiatal hernia issue. So it could go into the esophagus, it can erode the esophagus, you could get esophageal ulceration, you could get stomach ulceration, and a decreased hydrochloric acid production over time often leads to multiple things. Will lead to Helicobacter pylori overgrowth. So you'll have an H. pylori infection, which could cause an enormous amount of health conditions. You'll have a decreased intrinsic factor production. That's necessary for you to absorb B12. So you're going to have a B12 anemia issue. And it causes ulceration. So you end up with ulcers in your stomach, ulcers in your esophagus, and then you take Prilosec and it relieves your symptoms and you think you've solved the problem, but you're actually making it worse. You're causing a more long-term problem. You're pretty much guaranteed that you're going to have an H. pylori infection. So when a person comes in the office and they've been on Prilosec for any length of time, it's pretty much a guarantee that they have an H. pylori infection. The problem is H. pylori doesn't always just stay in the stomach. It doesn't stay in the intestinal tract. So if you do an H. pylori breath test, it may show negative. You do a stool sample test, it might show negative too. So how do you have to identify it with other factors? A blood test for H. pylori, it's only a test if it's in the blood right now. The problem is H. pylori gets under the endothelial lining of the arteries, and it's a major component of cardiovascular disease. So it is a major component, is the number one cause of stomach cancer. It's a major component of other cancers. It could cause skin issues. It's just a bad player in everything. And it is the most common bacterial infection on the planet. That's a statistic I did not make up. So it is a dangerous thing to be on these things. Again, again, when you use medication or you use herbs or natural methods of any kind that just cover up a cause, you could make the problem a whole lot worse. So you can't just cover up a cause. Well, I take Prilosec, it makes my tummy feel better. If I don't take it, I just can't stand it. Well, you've got to fix the cause. This is just making it worse. So it's a bad class of drugs, in my opinion. Next, what is the best way to diagnose or to find out if you have an autoimmune disease or diseases? Um, there's only one way to find out if you have an autoimmune disease, and you do antibody testing. So you could get antibody testing through your medical clinic that you go to. But typically, if you go in and say, I think I have an autoimmune disease, they have to have some justification for doing antibody testing because it's kind of outside the normal scope of testing. But if you have a good medical doctor that wants to dig to find the cause, they might do lupus testing or something like that. Now, there's really two different classes of autoimmune disease. There's systemic autoimmune diseases that basically can affect multiple cells, multiple cell lines, multiple tissues. That's bad. That's not good, right? And then there's tissue-specific autoimmune disease. So I have antibodies to my thyroid. My thyroglobulin antibodies or TPO antibodies would be a tissue-specific antibody. So I have antibodies to my thyroid gland. It's not going to affect any other tissues. The autoimmune disease itself is not. It's only affecting the thyroid. So running an antibody panel is the thing to do. I like Xrays labs. You could get just a lupus and antibodies through LabCorp or something like that, or Access Labs. But to get tissue-specific antibodies, you really have to go to more of a specialty lab, as far as cost-wise, to get an entire panel. Otherwise, you're ordering individual things, and it gets more costly. Xrays Array 5 is a tissue-specific antibodies to more systemic or peripheral tissue antibodies. Xrays Array 7X is more specific to neural tissue, so brain tissue, which we run a lot of those panels. And those are very important to run. So people that may come in and have issues with cognitive impairment of some kind, I'm losing my memory, I don't remember things well, it's good to run an Alzheimer's panel. If anything's positive on that, then we run a Xrays 7X, which gives more tissue specific to neural tissue. If you have antibodies to neural tissue, that's not a good thing. So if antibodies to any tissue, that's not a good thing. So again, like I said in the other question, if you have self-antibodies, you have a diagnosed autoimmune disease, everything else, how you learn to treat it, is out the window. You have to treat an autoimmune disease very differently than you treat any other condition. And quite honestly, a lot of doctors don't really get that. So you'll even go to natural doctors that say, oh, you have chronic Lyme, we're going to keep you on cat's claw. Oh, it's a flare again. It's not in remission anymore, so we're going to put you on vitamin C and cat's claw on this chronic Lyme protocol that is basically all immune stimulants, in the thought process that we have to kill this Lyme. It's the Borrelia has raised its ugly head again, and it's trying to attack you, so we have to kill this bacteria. Well, while that can be true, the only way to know that is to run a Borrelia IgM antibody test to see if you actually have IgM antibodies of a current infection. Many times that will be negative. Or run a white blood cell panel and your white blood cell panel are elevated, then maybe you do need to kill an infection, an active infection. Or a lymphocyte panel where you're going to get very specific and you're going to know whether you have a current infection or not. Most of the time, or I would say at least many times, people with chronic conditions like this, their symptoms, their flare is not from the infection raising its ugly head again. It's from destruction of tissue that which you have antibodies against. So you might have, got a cold or something, and that if you just if you catch a cold, your immune system is going to flare to kill that cold. Or if your daughter comes home with a strep infection, your immune system is going to flare to kill that strep. But when your immune system flares and you have an increased cytokine presence in the blood and in the tissues, you will create more white blood cells and to attack that which you have antibodies against. So if you have antibodies against self-tissue, you're going to damage more self-tissue in that process. So you do not want to flare your immune system. And that's the benefit of taking supplements that support what are called T regulation cells or Treg cells. Vitamin D is one of those. People think vitamin D is an immune stimulant. Well, it's really not an immune stimulant. It's an immune regulator. So if your immune system is suppressed, like you're trying to fight cancer and your immune system is suppressed, taking more vitamin D, get your vitamin D levels up, is beneficial. If your immune system is hypervigilant, in the case of an autoimmune response, then taking more vitamin D can help bring that down. So there's some other things on the market that are beneficial for autoimmune disease because they're really Treg stimulators. You do not want to take any immune stimulators. You want to stimulate T regulation or cytokine suppression. A totally different way to treat that. So you want to try to diagnose an autoimmune disease, you got to do antibody testing. And then if it is positive, you got to treat it in a totally different fashion than you've been used to probably treating anything that you know. So you can find out more on our chronic health and autoimmune course. So my arms are all scratched to death from weeding the raspberries the other day. Do you have any, this is the next question. Do you have any recommendations on level of vitamin D in the blood that you would recommend for your patients? Just kind of talked about that. I am mainly dealing with skin cancer. A few months ago, my tested level was 24, which I understand is inefficient. I get plenty of sunshine daily living in Mexico and pretty much never supplement for vitamin D, I think. But in spite of the careful sun intake, seems the level is not efficient. Although I rarely get sick with colds, flus, etc., if the supplement is recommended, what dose would you suggest to start? So vitamin D levels of 24, regardless of whether you have cancer or not, is way too low. So why would somebody have low vitamin D levels? Maybe start with that question. A person would have low vitamin D levels. Maybe they have a VDR. That's the receptor for vitamin D. Maybe they have a VDR gene defect, so that you could have specific vitamin D genes, and you have defects on those genes, so you don't produce as much vitamin D, you don't absorb as much vitamin D. That's one possibility. So I've had people that are taking 10,000 IUs of vitamin D daily, and they can't get their vitamin D levels over 35 or something like that. Well, then you look at their genes and they have a defect on that gene, so they just have to take more. Number two, a person can have a vitamin D a deficiency because they're on cholesterol lowering drugs. So 25-hydroxycholesterol in the skin is what is converted to vitamin D through the act of sunshine. So if you have if you're on a cholesterol lowering drug, it can lower that, and you could end up with difficulty making vitamin D from sunshine. Well, you could say, well, if I have to be on this cholesterol lowering drug, some people may have to be. That's another bad class of drugs, in my opinion. But if a person feels like they have to be on that drug, they can always supplement with vitamin D. It doesn't affect the absorption of vitamin D. They can also have gut issues. So if you have inflammatory gut issues, which you might not even have symptoms of, that can affect the absorption of vitamin D consumed. So probably some other thoughts of why a person would have low vitamin D levels. But then what do you do about it? So you're going to have to take vitamin D. So if your vitamin D is 24 and you live in Mexico and you get plenty of sun, you fall into one of those categories, and you're going to have to take vitamin D. I would start with, you always do something and then you remeasure, right? I would start with 5,000 IUs of vitamin D per day, maybe even 10,000. Vitamin D is stored. It's a fat soluble vitamin, so you don't necessarily need to take it daily. Some people take 50,000 IUs a week. But I think it's better to take things daily as far as helping with absorption goes. So maybe 5,000 IUs a week. It depends on the person's weight. And then remeasure your vitamin D levels and see if that's enough and if that's adequate for you. Again, like I think I said last week or the week before, when you do blood work and then you do some intervention, you want to remeasure to see if your intervention worked, right? I see that over and over again where that doesn't happen. Well, I don't think that's good doctoring. So, a few more questions here. My husband has been struggling recently with twitches in his hands and feet, sore spots around his joints and in his feet. He states his hands and feet go numb and his muscles feel weak and he's so tired all the time. Can this be related to endocrine issues or to neurological? He's a bit of a hypochondriac. Hopefully he's not listening, and just goes straight to thinking that he's dying. He's also suffering from really bad depression and anxiety, and he's been taking an NSAID drug because of this for years now. I don't know what to do or how to help him anymore or what doctor to go see. Well, again, okay, here's a symptom. So the person's having twitches in his hands and feet, and he's on NSAID drug for depression and anxiety, which, again, does a person have depression and anxiety because they have a deficiency in a medication? I don't think so. So getting to the cause of this and the root cause of things is really the way to go. Unfortunately, it's just not our medical system today. If you probably went to a medical doctor at 60 years old with these symptoms, most likely you're just going to get a prescription of something, which I don't think you have a problem because you have a deficiency in some sort of medication. It's just the system that we live in, and I don't know that there's really a way to fix that, but find a doctor that doesn't practice that way. So, yeah, you can contact our office and schedule a case review, and we can certainly start working through some of the process of uncovering this because you got to start digging. So as far as the twitching in hands and feet, what could cause twitching in hands and feet? Something as simple as, mineral deficiency, nutritional deficiency. As we age, many people aren't eating correctly. They can have twitching in their hands and feet can be a neurological issue. I would not say it's an endocrine issue. It's either neurological or just functional nutritional issue. If it's bilateral twitching in the hands and feet, it's probably more than likely a nutritional type thing. We'd have to dig into it a little bit. So as far as the anxiety and depression go, you want to dig into that a little bit too. Certainly, inflammation is at a root cause of a lot of different issues. You could have inflammation in the gut that's causing inflammation in the brain that's causing these things. Certainly that would tie to the anxiety and depression. One of your, a good video to watch is if you go on our website and you search in the search bar, go to connorsclinic.com, search in the search bar, neuroinflammation. I created a video, I think I talked about this a number of weeks back, but I made a video several years ago about neural inflammation, in brain inflammation. And it goes into detail. You might have to watch the video a couple times because it goes into detail about your microglial cells in the brain and what's called glial priming, which is so common. And when a person has anxiety or depression, that's your first sign. That's your first signal that you have microglial priming. And you have to start addressing it as early as possible because that's what leads to, microglial priming leads to chronic inflammation in the brain, leads to, which then can lead to antibody production of neural tissue, which is, can lead to all sorts of brain decline. And certainly Parkinson's and Alzheimer's disease are at the top of that list for somebody who's over 60 years old. And you don't want to, start treating an early onset dementia when you start noticing the dementia signs. When you want to start treating is when you start noticing the peripheral signs of anxiety, depression. I just don't have the drive I had anymore. Running those types of tests that we talked about before, the different antibodies tests, especially the Cyrex Array 7X, which is the neuronal antibody test, can really save a person's life. It may not prevent the person from getting dementia, but it can, if you treat it right and you do the action steps and the person is willing to be committed to some of the action steps that I lay out for them, you can push the dementia out 10 years. And that makes a big difference. If you've never experienced a loved one in your family go through dementia, you may belittle the issue. It is a big issue with that person when you lose your mind and you lose your ability to really think. I don't think that, the twitches in his hands and feet, unless they're acute, and if this has been going on a long time, I don't think that they're probably not related to something like brain cancer. Though in an acute issue, you have to consider that. If you have acute neurological issues like, most times brain cancer is diagnosed by, person having a seizure or something like that. So they have an acute neurological issue that they've never had experience of. But if you have, chronic, issues with twitching the hands and feet, you start thinking of inflammatory responses. So inflammation in neural tissue can certainly cause that. Upper motor neuron issues with in the prefrontal cortex, in the frontal motor cortex, what controls that function, and inflammation in the cerebellum. So the cerebellum smooths out all your motor function. Motor function meaning that I'm going to raise my hand. That's a motor function. I'm contracting a muscle. When I'm contracting a muscle and I have, tremors like this, that's typically a cerebellar function, and you have to look at cerebellar antibodies. And cerebellum is the back part of the brain that smooths that all out. So investigating that, finding out what is a cause, is the most important thing. And I will hound that until the day I die, is that you don't just treat a symptom, you figure out what the symptom is trying to tell you. It's screaming to you. Your body is telling you something. You need to learn how to listen to the body and find a doctor that will listen to that and dig to find some of these causes. Okay, let's see if any other questions came in. Remember, you could go to our holistichealthhour.com website and submit your questions there, then we'll for sure get on it. A few came in while we were talking. One is, are EMF waves less harmful than X-rays? Well, most certainly I would say yes. So EMFs are electromagnetic frequency. X-rays are also electromagnetic frequency. So X-rays are extremely damaging to the tissue. But of course, you have to weigh all that out. So if I have X-rays that have to do for my teeth, what's the rad dose of those X-rays? But they're not very high. So I could probably do, 50 tooth X-rays equivalent to one chest X-ray. The chest X-ray is typically what you compare things to, because as far as an X-ray itself, what's called a plain view X-ray, which is the old days when you took a X-ray and you had a X-ray, physical X-ray in front of you. Well, now we don't see that so much. We see it's all digital, but it would always compare to a chest X-ray because it's the amount of radiation that was needed for a chest X-ray. Well, if you have to go and get tooth X-rays, I don't know how many tooth X-rays are going to equivalent rad dose of a chest X-ray. Compare that to a PET scan or a CT scan. So let's say I have to do a CT scan of my lumbar spine because I hurt my back really bad. A CT scan is equivalent to about 50 chest X-rays. So again, it's the rad dose of the radiation that you're concerned with. And yeah, EMF radiation is bad too. So if I'm using my cell phone and I got it up to my head all the time talking like this, I never recommend that. That EMFs are going right through your head. It's the constant use of it. So what's the rad dose over time is really the question. So yeah, there's a different issue there. Question on Facebook. What's your opinion on people receiving blood transfusions from people who got the you-know-what and the blood clots found in the you-know-what from the you-know-what? new Japanese study on this. So, yeah, we have had to address this with our member base over the last few years. Some people are much more sensitive to shedding of those, the spike proteins. I myself was one of them when I was dealing with, when my cancer was very active and I was not doing well, and people came in and they promised they weren't, vaccinated with the what shot, but their husband was, or their family member was, and they were with them, and I would get sick. So I just said that's when we went completely to nobody's coming in our office. Everything's at a distance. It was just better for my health. And now that I feel like I'm in, remission, we're just not going back to that. So we've just kind of adapted. We can see more people across the country with what we do versus more specifically to, somebody having to come to our facility. So everything is at a distance. So as far as blood transfusions, yeah, that's difficult. I don't know where you're going to get blood. If you have to have a blood transfusion, what are you going to do? Where are you going to get blood that you know is clean? We live in a crazy world. It's just a crazy world. I'm totally against the thing that we're talking about, and have been from the very beginning, and probably just lost a whole bunch of viewers, but I don't care. So next question. Another question came in. My mom is fighting stage 4 colorectal cancer, but she also has Hashimoto's. If you want to stimulate the immune system in someone with an autoimmune disorder, does this change what types of supplements to use for her cancer? What a great question. Boy, you guys are smart. The answer is yes, it does, and no, it doesn't. So it depends on the autoimmune disease that person has. So if it's Hashimoto's and they have, let's say they have breast cancer, and you want to stimulate this person's immune system to kill the breast cancer cells, how are you going to balance this out? Well, to me, cancer trumps the autoimmune disease in this case, because, we're not going to die of Hashimoto's, but we could die of breast cancer. So we have to balance that out. And that's where you have to treat the person with some wisdom. However, there's lots of things you can do from an immune standpoint by using Treg stimulators. So, for instance, medicinal mushrooms are immune stimulants for people who have a suppressed immune system, but they aren't going to be hyperstimulants for people who have an autoimmune disease. So typically, everybody's a little bit different with this, but typically a person with Hashimoto's can take medicinal mushrooms and not have any uptick of damage to their thyroid gland. So there's ways to do it. Plus, you don't always kill cancer with just stimulating immune system production. So, step back a little bit. Does a person have cancer because they have a suppressed immune system? Many times, no. So it's not a suppressed immune system that is always causing cancer. Now, can that be the case? Yes. Do we have to use some immune boosters sometimes? Yes. Do we always? No, we don't. When a person has cancer, that cancer is in a state of high oxidative stress. Those cancer cells that are replicating aren't replicating healthy cells, not healthy mitochondria. They're not producing glutathione like they should. They're near the lethal dose of oxidative stress in the cell. So one of the major ways that we use to help kill cancer is, well, first of all, we use Rife technology, which is not immune stimulating at all. It's killing the cancer directly and stimulating an immune attack on the cancer and giving it, that tip over effect of the oxidative stress to the cancer cell. But the way chemotherapy works to kill cancer is creating more oxidative stress in the body that's going to create more oxidative stress in the cancer cell, tip it over to its lethal dose and kill the cancer cell. That's how chemotherapy literally works. Well, we do that a lot with a lot of the cancer nutrients. So you use higher dose vitamin C, even a liposomal vitamin C, certainly an IV vitamin C. You use elaetril type B17, you use a protocell. There's many of the therapies that we use that are not immune stimulating per se, they're oxidative. So they're creating a greater amount of oxidative stress in the cancer cell and thereby tipping it over its lethal dose and killing the cancer that way. So you don't always have to. You have to be careful. You have to be more careful treating a cancer patient when the cancer patient also has a concurrent autoimmune disease. Now, there's certain autoimmune diseases that are more serious with that. If a person has autoantibodies to myelin sheath cells, which we see commonly these days, then you really have to be careful stimulating the immune response because by doing that, you're creating a demyelinating disease, which is very serious. So there is different ways that you treat it with knowing that the person has a comorbidity of an autoimmune disease that's completely unrelated to the cancer. So great question. Okay, we are at our time. I thank you for being a part of it. Remember to go to holistichealthhour.com where Dustin does a great job of categorizing all these videos and putting a lot of text to them so you could read what time frame you want to get on and jump on the past videos. We have a lot of past videos, very well archived. Also go to connersclinic.com where you could access our courses. They're super cheap, no nonsense. You got to take the course. So there's no reason for you to be ignorant. The Bible says, I do not wish you to be ignorant. And my children perish for lack of knowledge. Now it's knowledge in the Lord that we're talking about, that he's talking about there, but I think it's general knowledge too. We're supposed to use this brain that we have, right? And use the studies that other people have done, and so you take our courses, you'll learn a lot from them, and the more you can study, show yourself approved, you're doing the right thing, you can help other people, you can help your family. I think we have a responsibility there. Go to connersclinic.com. You can see all our blog posts. Like I said, there's well over 1,000 of them. You can go to our YouTube channel and our videos at connersclinic.com channel 2. I don't know, 1,500 videos. Make use of these resources. Those are all free, okay? So thank you. Have a blessed day. I'll be praying for all of you. Remember to get your questions in for next week. Bye-bye.